The UAMS offers students an interprofessional education, which means different areas of studies come and work together.
So you'll see in this story how nursing, pharmacy, and medical students must collaborate to come up with a solution for a patient in the simulation lab.
Hello, Mrs. Smith.
Inside the theater area is a replica of a hospital room. Students at the University of Arkansas for Medical Sciences walk in the simulation center and must diagnose a patient's issue using limited information.
The first 2 years, a lot of it is bookwork and you can get kind of bogged down. So when you have the opportunity to actually do hands-on things and really feel what it's going to feel like, it's a great experience.
So in these theaters, we would run cases that we can then film. We will do the case to a certain point, at which point we go into a debrief room. We can watch the video back, we can see any mistakes that were made, we can talk about them, and then we can go back in and run the case again.
The simulation center features mannequins that cost upwards of $60,000.
They breathe, they blink, they can talk. You can hear heart and lung sounds. If it's a trauma mannequin, we can bleed. We have birthing mannequins that actually have a baby that comes out and it'll be blue, the head moves, it cries. And then if it doesn't, then we can go over and we can do resuscitations.
Along with the use of mannequins, students have access to standardized patients who are basically actors who portray real-life patients. Phil Griffey has been a part of the SP program for 9 years and sees firsthand how the students grow through experience.
You work with a student that comes in as a first-year medical student, and they come in the room with you and they're almost too shy to do it in some cases. Their cheeks get flushed and stuff like that, because sometimes we're talking about, difficult topics. But then you see them as a fourth-year medical student, and you see the knowledge and the confidence they have and their ability to keep that patient comfortable and to communicate with that patient.
UAMS students can continue their hands-on learning at the Health and Wellness Clinic on 12th Street.
But being able to come here, you learn about all the other fields and what it will be like when you step outside of school. You'll get to see what it's like in the real world.
Regardless of their insurance status, people can use the center like any other clinic.
They can come here for any sort of complaint that they may have, whether that's acute issues or more chronic things like diabetes and hypertension. And they come here and we see them with a team of students and get them medicines, give them treatment, things like that. I'm a fourth-year medical student, so I'm getting ready in the next few years to move out, and I feel like UAMS has prepared me so well to be a future physician.
Again, anyone is able to use the 12th Street Health and Wellness Clinic and receive professional care just like anywhere else. Pretty cool experience that these students get to have right there in school and treat real people.
Yeah, that is really neat. All right, what a great experience for those students.